Hello, everybody. Welcome. Today we are meeting for the second session of the Solid Talks. And today we welcome our speaker, Dr. Jarkyn Shadymanova from the American University in Bishkek. She will present her a book publication, NGO Involvement in Drug Treatment and Infectious Disease Prevention in Central Asia and China. This book was published in the Nomos Publishing House and is available open access. Jarkyn has been the postdoc researcher in the first project phase in the SOLID project and is still an associated researcher with the SOLID project. I'm really happy that we're here today, and we really would like to find out more about your book. So I hand over to you, Jarkyn. The floor is yours.
Thank you so much. And thank you so much for this Solid family. I'm very happy to be part of it because it's really good project with a lot of great inputs into the region. And then the outputs are so good. So that is why there was a second phase of the Solid. So I'm very happy to be part of the Solid family. Thank you so much, Solid people. Kasia, Ulla, Inga, and and Heino. So we, as a part of this project, published this book. I was editor of this book. It is an open access NGO involvement in drug treatment and infectious diseases prevention in Central Asia and China. And I would like to also thank a few people who are here. First, we are planned to do two presentations. One will be done by me. So I'm going to present whole book. And the second book is really great chapter about Wing Project. Daniel Nikitin is going to present. And then he is going to really share great insights of gender, empowerment, and other stuff. And also I would like to thank Ayjan. Here she joined. She was really helpful in the producing the book. So I really appreciate all her work. So, okay, good. My name is Jarkyn Shadymanova. I'm a sociologist. As Ulla mentioned here, I was a postdoc researcher from Kyrgyzstan during the first phase. And second phase, I'm going to hopefully to continue collaborate with a SOLID with the kind of associate researcher position, and hopefully we will do more kind of good work, collaborative work together, and with the great outputs like this one. So so the book was published, it's newly published, it was published in 2025. We have really great chapters there, and I'm gonna talk about this. So this book actually is a talking about the different roles which plays which plays by NGOs, and our book actually brings together a rich collaboration. Do you hear me? Our book brings together actually rich collaboration and of research, practice-based insights, and real-world case studies. The purpose of the book was twofold. First is to analyze the contribution of and strategies that NGO use in challenging health environments, and the second is to understand about the challenges and obstacles which they face different NGOs. And as we know, NGOs they are not only the service providers, but they're also advocates, innovators, and community builders in the regions where the state struggles to reach marginalized population, and especially problem with the funding. NGOs step in and they do a lot of work in the harm reduction, in the education, and social and psychological support. However, they carry out this work amid growing challenges, including the rise of synthetic drug use, which actually was our previous presentation. And I'm really happy that Maria published also very interesting book. Also drug trafficking, epidemics such as HIV, hepatitis C, and tuberculosis. And within this book, we are going to cover these aspects. So the book actually consists from two parts. One is examines the overall role of NGOs and infectious diseases preventing and and drug treatment, which includes chapters on policy, advocacy, organizational models, and partnerships, while second part is more case study, which are actually talking is taken from the Central Asian first-hand organizations, NGOs working like in the countries, and then so like one or other way you heard, come across, or collaborated with those NGOs in the region. So first chapter, first starting point, I would like to start with the ULA's paper, which was the chapter number 2, NGOs in Drug Policy, Lessons from Europe for Central Asia, China. So the author, again, Ulla, in this chapter, Ulla reflects on the role of NGOs in shaping drug policy in many countries, civil societies as a vital actor in the field of drug policy, and which includes not only the formal NGOs, but also self-help organizations and informal associations. These organizations often step in to fill gaps left by state, especially in areas such as prevention, treatment, and harm reduction. Ulla actually is arguing that NGO performs a variety of important functions such as advocacy, including lobbying, policy dialogue, and outsiders approaches like campaigns or right-based initiatives. NGO also main service delivery, for example, harm reduction and addiction support services provided by the organizations such as ADHA in Frankfurt, and they are community builders because many NGOs promote peer-led initiatives such as Jess Network in Germany, which empowers people with lived experiences to become advocates and supporters for others. And Ulla concludes from the European perspective or experience, we can actually identify several valuable lessons, such as policies and programs are most effective when they start from community needs and lived experiences. And secondly, is NGOs that professionalize their services and build umbrella network gain legitimacy in the country and more sustainability in the country, which actually are bringing more kind of positive impact. And finally, the state NGO cooperation is essential because governmental support can strengthen harm reduction, while NGOs bring flexibility, innovation, and trust within the community, especially for the Central Asian region, where the state funding is less available. We know that the situation in the country. In summary, Ulla is claiming that NGOs are not simply service providers, but they are change agents that connect policy with the people, learning from European models, which are already kind of have years and years experiences on doing it, can guide us to building more stronger, more human, and more effective drug policies across Central Asia and China. So this is actually first starting chapter. The second chapter is actually from our also solid person, Inga Ilya Michels, and he examines the role of self-organization among drug users in Germany based on the Jess network. So this case is an important example of how empowerment and participation can transform both the lives of people who use drug and the broader drug policy landscape. So the movement itself began in 1989 with the support of Deutsche AIDS Hilfe in Germany. And this NGO actually promotes harm reduction, safer use, and social inclusion and its core principles. And also it advocates for the ideas that every person diverse in life with dignity, or they put it for a decent life with the drugs. And this was the radical shift from treating drug users as criminals or the patients to recognizing them as individuals with the rights and policy. an agency. The philosophy of the organization JES Network is rejecting criminalization and instead focused on self-help and peer support. And it built a rights-based model where people with a lived experience become leaders and educators, offering advice, care, and solidarity to others. So over time, this organization, self-organization, grow into what we know and widely, spread in Germany as known as JES Network, which stands for the Junkies, Ex-Users, and Substitutes. Today, JES operates across Germany and serve as a global inspiration for other countries. And the motto of the organization is "No decision about us without us," which emphasizes participation in a drug policy. So the next chapter is actually very kind of revolutionary these days, especially with the AI, agency and era, which has just started. And this chapter was written by our solid colleagues from China, Tianjin and Hansu. I think they are still in the project. They explore AI and neuromodulation in addiction treatment. These emerging technologies allow NGOs to deliver tailored, more scalable intervention, and cutting-edge technologies are opening new avenues for accessible addiction treatments, creating scalable models for digital intervention through digital health platforms and AI therapies. However, since the AI was just introduced, there are still, challenges which are remaining and coming new ones. And then one of the examples might be data privacy, access to the technology, and the need for the medical validation. And the authors are actually kind of elaborating on that. However, this chapter demonstrates how tech-based innovation is rapidly expanding the toolkit of social work and public health in China, and I guess that might be also used as a model for other countries. Next chapter is about legacy. So myself and my co-author Nazgul Shankulo, we actually wrote about the legislation and local elites impact on NGO effectiveness in Central Asia, and we analyze each country in the region, and we defined that in Kazakhstan we see strong state control but growing collaboration. In Kyrgyzstan, NGOs were pioneers in prison-based harm reduction but face funding limits. In Tajikistan, NGO activities hindered by human rights restrictions, while in Uzbekistan has made progress, but criminal penalties for HIV transmission still create fear and stigma in the country. And we argue that regional legal reform and destigmatization are essential to scale up and the impact of the NGOs in this area. Going to the next chapters, this is more kind of case countries, an analysis of the country cases. So the chapters 6 and 7 focus on the experience of NGOs in Kazakhstan and Uzbekistan, more kind of overall overview. Both chapters provide powerful regional perspectives on how civil society organizations contribute to addressing drug use and infectious diseases in Central Asia, and particularly the chapter 6, which was written by Medet Kudabekov, who's one of the colleagues from Solid Project, and also colleagues Mukhambetova and Baygabila from the Kazakhstan. They are actually exploring NGO efforts in Kazakhstan, and they are highlighting how NGOs have become essential in addressing high drug dependence rates and the related spread of infectious diseases, particularly HIV and tuberculosis in the country. And these organizations play a crucial, critical role in education, awareness, and harm reduction program, offering service that the state alone cannot provide because they have more kind of extended networks. And their efforts not only save their lives, but also help reshape public attitudes toward drug use, moving away from punishment toward care, understanding, and prevention. And the key takeaway here is that NGOs in Kazakhstan are not merely service providers, but they are bridges between vulnerable communities, marginalized groups, and the healthcare system, ensuring that harm reduction and social inclusion remain central to the national responses. And since the governmental role is quite powerful, NGOs are trying to connect this group with the resources, healthcare resources. And chapter 7 is written by Guzal Zahidova. I think she's here. She focuses on HIV prevention and support for marginalized groups in Uzbekistan. And she is claiming that NGOs have established a safety net for vulnerable population, including people who use drugs, sex workers, and migrants, through outreach, counseling, and harm reduction programs. These initiatives these initiatives not only reduce health risk, but also promote dignity and reintegration into the society. Importantly, they demonstrate that inclusive and community-centered approach can make national health system more effective and compassionate. So together, these two chapters illustrates how what is the role of NGOs in Central Asia, and what kind of crucial role they are playing in transformative roles, filling service gaps, advocacy, and for the rights, and promoting harm reduction in environments where the stigma and criminalization are still strong. Their work these chapters underscores the simple but vital message: public health and human rights must go hand in hand in order to make some changes. Okay, so then we will actually start our second part of the book, and this is more kind of case study based part of the book, where we are sharing different experiences, histories, and case studies from like leading organizations in Central Asia. So the chapter 7 is about Infectious, which is I think, known in Uzbekistan, and in general, I think in Central Asia, who are working in Uzbekistan. And this chapter was written by the founders and leaders of this organization: Tatiana Nikitina, who is the founder of the organization, and Elena Devyatova. They are these days are leaders of NGOs and doing like quite a lot of work in the region. In drug treatment. So the chapter highlights the impactful work of the Infectious, which has been established in 2003 in Uzbekistan and still operates, and they are really one of the leading kind of organizations again in the country, and they do quite a lot of work. Infectious has supported vulnerable groups, especially people who use drugs in prison settings. Their service go beyond harm reduction to include legal, social, psychological support, making their approach more holistic and human-centered. Most importantly, Infectious actually was a pioneer in trust-based outreach, using trust rooms, social media, and approachable healthcare professionals to build connections. And thanks to these activities, now they are have trust from the marginalized group. And they're also working in the tuberculosis care, into the bringing tuberculosis care into the prisons, and use the internet to reach people using new psychoactive substances. So far, they have provided over 36,000 services, and their work is now part of the Uzbekistani national healthcare system, showing that how like important and successful their efforts, and then like appreciated by the state, which is quite important, I think. So this is about Infectious, and here you can see their logo, right? And this is actually Nikitina. and next chapter is wings in Kyrgyzstan. Daniel is going to talk more about the chapter itself, but I would like to emphasize that the wings model has grown far beyond its original scope, which was started in 2013, and now it has been scaled to the 14 NGOs, adopted in 6 countries and translated into 8 languages, which is quite good achievement, which shows the wings model is adaptable, effective, and helps empower women while preventing gender-based violence in different cultural contexts. But I don't want to kind of share more insights, while like here the first hand will be shared later on. Next chapter is a few, and recently, during the based on the political situation in the country, I think they've changed their names. So the FU in Kyrgyzstan is one of the oldest and leading organization. And this is actually our chapter 10, which was written by the Natalia Shumskaya, who is the leader of the organization, and Chinara Imankulov, who is also one of the key person in the organization. They highlight the innovative approach of the FU in Kyrgyzstan in their chapter. Actually, FU has been active in Kyrgyzstan since 2005, focusing on HIV prevention and harm reduction. And the organization's main goals are to promote HIV self-testing, connect users to the care, and reduce stigma, especially among hard to reach and high-risk population. And in 2023, FU reached 1,781 users, all of whom were tested for HIV, with 4 individuals linking to the care. And what makes FU's work actually more remarkable is its use of digital tools such as Telegram bots, messaging apps, online forums, mobile applications, and chatbots to reach vulnerable people who might otherwise remain silent and invisible. However, despite this success, the organization still faces challenges, including distrust, stigma, limited follow-up after the self-testing, and they are admitting in their chapter these challenges. And to address these issues, FE emphasizes privacy, non-judgmental care, and strong network. And their strategy demonstrates that combining technology with the empathy and trust can break down barriers and bring life-saving support to those who need it most, which is very important, especially with the vulnerable and marginalized group of people. So this is about FU. And next chapter we've got about tuberculosis from Yulia Alekshina. And she is actually talking about how NGOs in Kyrgyzstan help improve treatment for people with the drug-resistant tuberculosis. And the main goal was to prevent patients from dropping out of treatment and to bring back those who already had stopped treatment. And the main NGOs, 2 NGOs such as Red Crescent Society and Plus Center, both founded by the Global Fund, worked in this field, and they actually the achievements quite impressive. They actually started with a 3-step models. First step was basic support for all patients. Second was additional help for those at risk of dropping out. And the third was a special follow-up for those who had already quit the treatment. And she's claiming that NGO workers stayed in close contact with the patient through their home visits, phone calls, video checkings, and they also helped people manage side effects, travel difficulties, and fear of stigma. As a chart here shown, you can actually see that the approach made a real difference. Dropping rates fall from 27% here to below the 10%, and even it happened during the COVID pandemic time. So, and this is actually the example this example clearly shows that good communication, continuous care, and human connection can save lives, which is really like giving real results. And next chapter is written by Public Foundation DOOR. Maybe some of you know this organization. They are actually working quite actively in the tuberculosis issue. So this chapter actually discusses how NGOs help in Kyrgyzstan, such as those, helps people fight tuberculosis. And actually, this public foundation, DOOR, was registered in 2009 and works closely with the local communities to reduce stigma, support patients, and make tuberculosis treatment easier to follow up. And they are actually also using quite actively new technologies. They developed a platform called Unified Communication Digital Platform, which includes first a training program, secondly patient schools, and third virtual psychologist named Dr. Azamat to support people's mental health issues. Public Foundation DOOR also provides videos for the young people in order to do the awareness raising campaigns and engage community leaders in discussion on how to improve tuberculosis services in the country. Thanks to these efforts, more patients are staying on treatment, experiencing less anxiety, and receiving better overall care. And this chapter actually shows that with the right tools and strong community involvement, NGOs can play a crucial and powerful role in improving public health outcomes. So these are the all chapters. So in conclusion, I would like to say that this book highlights how NGOs in Central Asia and China play a vital role in protecting public health. Their work is grounded in community-centered approach, and they are very flexible, innovative, and deeply responsive to the people needs, which is making more kind of human-centered approach. NGOs are not just filling service gaps, but they're, especially in our regions, are leading efforts to sustain treatment programs and respond rapidly to the emerging health challenges. And most importantly, collaboration between governments and NGOs is very essential, especially in the state-centered countries. Collaboration, when these partnerships are strong, public health system become more effective, inclusive, and resilient. And the impact of NGOs work goes far beyond individual projects. It provides valuable lessons for the entire global health community. Because each of the countries has their own kind of uniqueness and, you know, their starting points, such as FU's experiences, Intellish experiences, and you know the Public Foundation DOOR experiences, or the Wings experiences, both the Wings models, so which might be very useful, you know, to the general audience who are working in the field, not only in the region, I mean. And finally, as a call to action, I would like to say that we must recognize, value, and support NGOs to ensure stronger, more fairer, and more sustainable public health system now and in the future, which makes our societies more sustainable and, you know, more kind of human-centered approach, using human-centered approach. So these here are the chapters, references, and again, this is an open access, so you can download for free. And thank you for this opportunity for the Solid project, because they paid quite a lot of money for it. And that's, I think, it from my side. If you have any questions, I would love to respond, if I am okay with the time frame.
Thank you very much, Jarkyn. That was really a very interesting presentation, a great overview of your book. And I think what is really striking is that we see so many similarities between the different projects, and it's only your book publication that actually brought all these different experiences together. So I think it's a wonderful overview, and I think we can ask people if there are some questions right now to your publication. Maybe someone would like to immediately ask the question. If it's easier, you can also write a question into the chat. And a question can, of course, also be a comment or a remark.
Or send by email.
Mhm.
Or send by email. Here's my email contact details. So feel free to reach me out if you have any questions or requests or whatever. I would love to share the book itself if you have like problem with the downloading. And this was just an overview of the whole chapters. Chapters are more interesting to read, and more useful, I think, if you do by yourself. So yeah, here I will stop then, I guess.
So, yeah, are there any questions? If not, I think we can move to Daniel Nikitin and hear something more about the Glory Foundation.
Yeah.
Yes, Daniel, the floor is yours. If you would like, I can make you a co-host. Wait a moment. And then you can share your presentation.
He should open his microphone, I guess.
Yeah. Daniel, we cannot hear you at this moment.
You are muted.
Jarkyn, I cannot share my presentation. So now it is open.
Mm-hmm.
And
I think you can. You still cannot? I can share if you want.
Please.
Yeah, okay. Let me find it. Great. So give me a few minutes. It's my yeah.
So,
Oh, it's coming. Give me a few minutes.
yes,
I have
okay.
opened. Do you see it?
I think it's uploading right now.
Okay.
Yes, here we are.
Look, so beautiful pictures, huh? They are all co-authors of our chapter.
Yeah, so thank you so much, Daniel Nikitin, to be here with us today. And we are looking forward to your presentation.
Thank you very much for invitation to these solid talks and the opportunity to present the overview of the chapter published by NOMAS in their book titled NGO Involvement in Drug Treatment and Infectious Diseases, prevention in Central Asia and China. The chapter that we contributed is titled Wings in Central Asia, an intervention for gender-based violence prevention. Jarkyn, please, next slide. Thank you. I would like to express appreciation to Dr. Jarkyn Shadymanova of the American University of Central Asia, Dr. Louisa Gilbert and Dr. Timothy Hunt at Columbia University, Dr. Tina Jivatram-Niron at the Arizona State University, Dr. Asel Tserlikbayeva of Columbia University Global Health Research Center of Central Asia in Almaty, Ms. Alla Bisonova at Women's Network of Key Communities. We are all grateful to all project beneficiaries for their responsiveness and willingness to participate in the project. Without their commitment and desire, the results achieved would have been impossible. I would like to also acknowledge donors at Open Society Foundations, Soros Foundation Kyrgyzstan, UNDP in the Kyrgyz Republic, Beers Trust, UN Women, and other agencies for their generous support and sharing scientific and practical ideas. Thank you. Please, next slide. Our chapter explores the role of the Wings intervention in prevention violence and reducing the harms associated with substance misuse, including comorbid conditions, traumas, stigma, and discrimination. Wings stands for Women Initiating New Goals for Safety. It is an evidence-based screening, brief intervention, and referral to treatment model. Look, screening, brief intervention, and referral to treatment. The abbreviation would be SBIRT. It is focusing on raising awareness of and screening for different types of intimate partner violence and other gender-based violence, safety planning, enhancing motivation and social support to address violence, goal setting to reduce violence, and linkage to GBV and medical services. Wings can be delivered as self-paced mental health web-based tool or by a facilitator in person, or a hybrid format with a facilitator prompting participants to go through the self-paced tool. Wings is designed as a low-threshold intervention that peer advocates or laypersons with proper training can use. Not only professional psychologists, but really laypersons, peer advocates, equal those who also had like violence experience in their lives. So it's all possible. Our chapter presents a case study from the Glory Foundation's successful 10-year experience. 10-year experience of designing, implementing, and disseminating Wings in collaboration with the network of NGOs and renowned researchers, and identifies the factors that have driven the successful implementation of the intervention. Please, next step. Next slide. What is SBIRT? SBIRT stands for Screening, Brief Intervention, and Referral to Testing or Treatment. The goal of the screening is to identify the client's drug and alcohol misuse status, as well as their fears, concerns, and possible barriers that would potentially restrict the participant's safety and their access to detox, follow-up treatment, psychotherapy, and rehabilitation. Brief 8-step intervention is performed in a form of collaborative conversation that enhances the client's motivation to change their NPS misuse behavior and explore the advantages associated with linkage to treatment and rehabilitation. The brief intervention includes offering advice as well as peer-led education about minimizing risks associated with substance misuse and HIV, HCV, STI transmission, and contracting COVID. For managing referrals to detox, follow-up treatment, and rehabilitation, the agencies employ their peer navigators who have been effective in scheduling appointments and establishing sufficient communication between participants, family members, physicians, and other stakeholders. Please, next slide. Thank you. The following modalities of Wings are available now in Kyrgyzstan, each adapted for the specific needs and specifics of the beneficiaries. Wings of Hope. It is designed for government and non-government agencies providing services for women who use drugs. It is we call it the classical modality, which this was the beginning, the first step which we developed. The second one is Wings SW. SW stands for sex work. Wings SW, it is for NGOs providing services to women engaged in sex trading. Now you will ask, why have different modalities for women who use drugs and women engaged in sex trading? Well, but risks are different. Risks of violence is different, and if risks are different, then intervention has to be different as well. Violence perpetrators are also different in these two cases. Well, that is why we developed several modalities for several groups of potential survivors, violence survivors. The third one is Wings Sunflower. It is for community-based crisis centers and shelters providing services following a one-stop model. One-stop model, look, it is, well, a woman applies to a crisis center and she receives the whole package of services in this crisis center. Now she is not obliged to travel to police, which is 5 kilometers far from the crisis center, and then go back to a polyclinic, which is 7 kilometers far from the police station. No, all those service providers will come to the shelter, they will come to the crisis center, and they will try to provide the whole package of services to this woman inside this crisis center. Well, it was a great achievement, by the way. 5 years ago, this would be impossible. We were pioneers in doing this. And the fourth one is Rural Wings. It is for community-based and municipal women servicing agencies working in rural areas. Absolutely unique model, really, because services in Bishkek, in Osh, in Jalalabad, they are more or less available, but services in rural areas, guys, they are so much limited. So, and we tried to somehow equip those social workers and women servicing case managers to empower them to do something to help those women in rural areas who need their help. Please, next slide, Jarkyn. Thank you. Number of agencies in Kyrgyzstan trained in Wings methodology that is integrated in their services performed on daily basis increased from 2 in 2013 through as many as 14 in 2024. The next slide is of the 14 Wings agencies, 29% are advocacy and policy making agencies with sufficient research capacity, assessment capacity, monitoring and evaluation capacity. We need someone in the agency who would be able to monitor all the Wings activities on daily basis. Of the 14 agencies, 43% are members of the Kyrgyz Crisis Center Association. Most of the agencies are community-based grassroots NGOs. 3 agencies manage shelters, and 1 agency is the government-run Republican Narcological Center. The estimated number of women who benefited from Wings services through these agencies during 10 years is more than 1,000. After Kyrgyzstan, Wings was applied in Ukraine, Georgia, India, Kazakhstan, and Uzbekistan. Guys, I think it is a success. Well, what the, but well, I mean, well, next slide, please, Jarkyn. Thank you. Each of the 14 agencies which I mentioned in the previous slide, each of those agencies is equipped to be a Wings Resource Center. We call it WRC, having access to the Wings specific intervention methodology, TOT resources, and databases. There are 7 resource centers in the Kyrgyz capital town of Bishkek, 4 resource centers in the second largest town of Osh, 2 resource centers in the town of Karakol, and 1 resource center in the town of Narin. Unfortunately, we do not have resource centers in Batken, if you see now the map. We do not have them in Talas, which borders on Kazakhstan. I would love to really expand Wings there, but we need more resources for that. Next slide, please. Focal points in each of the 14 Wings resource centers are trained to facilitate individual face-to-face and online sessions that include the key components of Wings screening, brief intervention, and referral to services intervention, available now in Russian and Kyrgyz languages. For Osh, we tried to translate this intervention to Uzbek, but so far it is just our plan. As mentioned above, depending on women's needs, the intervention components are adapted to women who use drugs, women who engage in sex work, women living with HIV/AIDS, women who misuse potentially addictive medications and alcohol, and also depending on funders' agenda, the sessions are supplemented by testing for HIV, HCV, and COVID. Next slide, please. I think you have a reduced version.
Okay.
In any event, I'm already almost done. The WINGS model brought to Kyrgyzstan by NGOs and further developed with NGOs engagement has been and continues to be a critical endeavor, and it not only expands society's knowledge and awareness of the problem of gender-based violence, but also strengthens community capacity to support individuals who are experiencing violence or are at risk of violence. Furthermore, it represents a long-standing collaboration between civil society organizations, leading research universities, and NGOs that are working to bridge the gap between those two groups. The WINGS model, in its different modalities and adapted to the needs of participants of particular groups of beneficiaries, seeks to address gender-based violence and associated harm through rigorous training and support, and has transactional potential with scope of adoption, adaptation, and scaling up. WINGS is a model that is quite applicable for government agencies, so it makes sense to facilitate smooth WINGS integration into their standard practice. So that's it. Thank you so much, Jarkyn, for your assistance.
Thank you very much, Daniel. I think this is wonderful. We have seen now the overall structure of the book, and we have seen one very successful project. I would like to open the floor to our audience. We have some PhD students from the SOLID project here, some postdoc researchers. So please feel free to ask the question to our presenters. As mentioned, you can also write the question into the chat if this is easier for you.
I have a question.
Yeah, you're welcome, Maria. Floor is
Hello,
yours.
everybody. Yes, it was interesting. Thank you, Jarkyn, for this presentation. It's a huge amount of work. I know this. And thank you, Daniel, for sharing your experience with interesting project. As I have a question as a governmental doctor, as a representative of governmental organization. So about WINGS, how did you manage to attract, to engage clinicians to your project? And the second most important for me point is, how did you manage to ensure their consistent engagement, consistent services, their ability to participate in your project? Because in Kazakhstan, state governmental clinics are resistant to broaden their abilities, their mandates. They don't really want to reach out women's, for example, like in crisis center. Thank you so much.
Thank you so much, Marie. And like as a side note, thank you very much for other book that was also published within NOMA. So thank you so much. Well, Maria, but in Kazakhstan, the context is a bit different. Now, look, in Kazakhstan, you have the government crisis centers. In Kyrgyzstan, we do not have any government center. So far, we have one, but I think it is available only for 10 or 14 women for the whole country. Now, can you imagine that the whole network of crisis centers that is available in Kyrgyzstan, they are private crisis centers. Not private, but NGOs, non-government ones. So those guys who work there, they absolutely appreciated this model because it was really like, it made sense actually, because when you build your activity, your case management with a woman on this SBIRT model, it makes sense. First of all, you really screen a woman. for example, if she's a migrant, if she's an undocumented migrant, if she is a woman who uses drug, if she, well, you screen her for various scope of issues. Then you provide pretty much universal intervention. Then you, together with her, map the service providers, and you navigate her to those service providers. Most of them are also non-government ones. So there is nothing that can cause questions, that can cause any resistance. The problem was with Narcological Center. The problem now is with Republican AIDS Center. Apparently, the whole network of AIDS centers that we have in our provinces, if a woman with HIV experiences violence, and if she applies to this AIDS center, there is nobody there inside who would be able to help her. Unfortunately, so far, they do not have any intervention model. Good or bad, it doesn't matter, but any. So if a woman has this issue, and if she opens the door, knocks at the door, and asks for help, there is nobody to help her there. While this will be what we will have to do in next couple of years, I think. So, well, but it's a good question.
Thank you very much, Maria. Yeah, we see that cooperation with the state institution is not that easy. There has been another question. Yeah, please go ahead.
The iPhone, I think.
Yes.
I don't know the name.
Hello, dear colleagues. iPhone, I think it's Shahnoza speaking. Sorry, I just had to switch from my computer to a phone, and I'm driving, sorry. But I also wanted to thank both speakers, Jarkyn and Daniil, for the nice and good, interesting presentations. And I also wanted to mention that, Daniil, thank you for mentioning SBIR. It's really a very good instrument which we are trying to introduce in our region for many years. And now we're talking about it and that it should be introduced in the primary health level. So thank you for using that good tool in your work. And I do hope that maybe those who are attending now these sessions can consider to use it as well in their work, and maybe we can do something together. Thank you. This is all from my side.
Thank you, Shahnoza. Thank you so much.
Thank you. And we have another question or comment from Ingo Ilya Michels.
Well, yeah. Also, thank you very much for working on this very interesting and helpful book, hopefully. I just want to mention, when I have been living in Kyrgyz Republic in Bishkek, together with my wife, she had been working for the Friedrich Ebert Foundation at that time, 2010, 2013. We have been aware, a friend of us, she was victim of violence by her husband at that time, and we tried to find some ways to support her. It was very difficult because she said going to the police doesn't make any sense. She was very afraid on this, and unfortunately at that time I didn't know about your very, very helpful project, but then I hope, because at that time we have been aware of this situation of violence against, especially against my husbands, against the women, and it was very difficult to find support for these women, especially by the prosecutors or police. The same is true in Germany as well. And then I have been aware, or I have heard about a new law in the Kyrgyz Republic that supports more ways for working against violence against women in your country. Is that true? And is it working? Has it come to into force? And the second part goes to Jarkyn. Thank you very much, Jarkyn, for your very helpful work in this. And because I could also be part of this work and report about the self-organizations in Germany. And I know that there is still some cooperation between the German self-help groups and those in Central Asian countries. But do you have an idea, has this book any influence on the situation in your countries, in Central Asian countries, to support more development of self-help groups or NGOs? Do they have better, how to stand, is there better understanding by the governments to listen to NGOs, to involve them into their policy? That would be great. In Germany, we have this experience, but it's still very difficult sometimes, and it depends very much on fighting of those who are working in the field to involve NGOs. And in Germany, most of the drug services are NGOs, but only a few drug users themselves are involved. The Yes organization is very important. What is your idea in your country? And maybe you two can give me some ideas on this. Thank you very much.
Danielle, would you like to respond to the first question, and then I will
Yeah,
follow up with you.
Jarkyn, I just remember my recent presentation at one of the sessions at American University. I was invited there by Nurgul Nurkiyazovna. It was about NGO's role. Now, the conclusion that we had by the end of the session was that we are not the enemies for this country. Absolutely not. We are open to working together. We know our role, we know our capacity, we know our, well, advantages and probably disadvantages as well. And we are really ready to work together. So this is what I wanted to say.
Yeah. Yeah, thank you. Thank you, Inga, first for the questions, and secondly for your contribution, which was very valuable in the sense of whether like this book was kind of have an impact. I think it's quite early to say because it was published in February and then not many people kind of reached the readers, and secondly, the book itself in English, and then like the English language is not that like, I mean, educated people are more and more kind of knowing English. For example, Daniel, myself, Aijan, but they're like quite big majority of the population, they cannot actually freely read in English. So that is why I think it is still early. Hopefully it will have more impact later on. And usually, as you know, in academic way, it takes quite a few years in order like to reach the readers. This is one thing. Another thing is that like self-help organization, I think, is organized within the NGOs themselves, and they have their own groups, outreach people, and so on and so on. But in the sense of like the countrywide self-help groups, I can barely say it exists in terms of like country openly kind of wide. But I think in the NGOs they have some networks, they have their own groups, and they work kind of in a latent way. This is like another thing. And in the sense, I absolutely agree. I think, if I'm not mistaken, before, in terms of like violence against women and like, the early marriage and other stuff, the in federal affairs, like the law allowed to accept the report from the like close people to the victim, such as, I don't know, school administration or relatives or the neighbors. But I think in like last month they changed the law, and now if you want to report, you have to like, I think you're gonna go through the certain type of the checking in order to avoid extra work from the law enforcement. So this is very sad, because not all of the times victims are able to report about the violence cases and other stuff. So that is, I think, sad. But then since it happened like recently, what will be the consequences, we're gonna learn, I think, in like soon. But I think that like being a gender like researcher and NGO like third sector researcher, for me it is really bad sign, because not all of the time like the victims are able to report, because most of the times who are the perpetrators? Mostly like close people, right? The relatives and other people. So that is why I think it is very sad, but we will see. But in general, I think, thank you for the questions. And yeah, I would love to have more kind of, to say, yes, my book, like our book made like some changes, but hopefully it is coming and it will do some changes, hopefully, but we'll see.
And also, Jarkyn, let me add, well, about the first part, the sad part of the question. Well, unfortunately, well, I'm really so sorry to hear about that case with a woman who really, well, who needed help, but it was not available at that time. I remember the very beginning of our project in 2013, when we were struggling with ourselves to advertise ourselves or to keep it quiet. And finally, we were wise enough to keep ourselves quiet, to not issue those ugly posters with, well, shouting males and suffering females. No, let it be really the word of mouth way of spreading the information, because what women absolutely need in the situation of violence is confidentiality and privacy, and it is impossible to achieve if we try to like label an agency. You can come here and get Wings services. No, it is absolutely illogical. It won't work, and we decided to work quietly. So I think we were, well, wise enough. So really sorry.
Yeah, thank you for mentioning the importance of confidentiality in this work. Maybe for you two speakers, the two presenters, one question from my side. I would like to know, do you see any common problem faced by many of the NGOs that you studied for the book, Jarkyn? And maybe you, Daniel, can also see some common problems, barriers faced by many NGOs or community projects. Thank you.
Yeah.
I think dependence on donors, Jarkyn, but you can go.
No. Go ahead, please. Go ahead.
Well, shortage of finance support. I mean, there is not enough funding. So what can we say? Unfortunately, we really depend on funders, on donors, and when donors change, I mean globally, then we appear to be really
visible.
Well, yeah, unfortunately. Well, it's...
Will it have an influence, the new policy in the United States? That because when I worked in Central Asian countries, I worked very closely together with USAID, and now they are, how to say, I think that might have very negative consequences, I guess.
I think it depends on the organization who is getting, like, from which sources they're getting fundings. And yeah, of course, USA did quite a lot of work here. I think 30% of the funding will be cut. But like the other organizations are still there, Global Fund and other organization, hopefully. But what is the main common thing is that, like, recognition, I guess, the amount of work which are doing NGOs. And then, like, in all Central Asian countries, social, psychological, emotional part of the drug treatment in the marginalized group are not recognized by the state. So it's mostly about the medical treatment, which, like, it doesn't mean that it ends, because, like, as a people, they have other problems, legal problems, social problems, psychological problems, emotional problems, and those things are kind of NGOs are providing services, but this work is not that much recognized as like it's supposed to be. So that is why. Another thing is that, like, if you have NGOs, the state organizations, the state agencies think that you have to do those things, although there is quite a lot of work, and they're like emotional work of the NGO, like, workers are really, like, insane, and nobody actually kind of recognizing it. And another thing is, as Daniel mentioned here that funding, the scarcity of funding, big issue, because states, like, most of the time, I guess, like, maybe this doesn't refer to the Kazakhstan, maybe Uzbekistan, but in sense of Kyrgyzstan, Tajikistan, the state doesn't have enough funding for, like, because budget are cut in a different ways, right? Social aspects are really least funded, while, like, the drug treatment, gender issues are the least, like, in the bottom of the funding options by the, like, budget of the state. So that is why the funding is really huge issue. So that is why organizations are working, such as FU, Intelligence, or the Glory, they are doing quite a lot of work in order to get funding and to do the projects in the country. And sometimes, as Maria here asked, like the state organizations do not actually recognize their work, and they don't want to collaborate, which actually kind of creating another obstacles in order, like, implementation and achieving the clients and, the people. So those are the things. In general, I think, of course, the situation is different in the countries, although we still have some common things such as scarcity of the funding, invisibility, not actually recognizing the vulnerable group of the, population. And those are the mostly suffered, like, population in the country.
Thank you, Jarkyn. Thank you very much for this wonderful meeting today. Is there a last question or comment from our audience? If not, then I would like to close this meeting. I would like to.
Can I? Yeah.
Yes, of course.
Before finishing, Ulla, can I say something? So we actually we had other presenters who would love to present their chapters, and we actually kind of preliminary agreed with Ulla to do in a Russian language this talk for those authors who can present in the Russian language, because the chapters were translated into English and published. So later on, hopefully, I don't know when, but we are going to organize the similar talks in Russian languages. And Daniel, if you want to contribute, you are very welcome to do so. So I will reach out later on to do the same, because like here I try to present the book chapters, right? And like, on the second, like, hand. And while as Daniel here presented their paper, it was more visual and more interesting.
Yes, that's very important information.
I think it will be very valuable.
Yeah. So the Solid Talk series is in general open both to English presentation and to Russian presentation. So whenever you have a topic that you would like to discuss with a PhD student, with a postdoc researchers, or in general with a Solid team, you can make a suggestion and we can set a date, and we publish the dates on our website. Please be aware the new Solid website is called www.solid-project.org, and you can find this in the chat as well. Now I would like to mention that the next meeting of the Solid Talk series will take place in 3 weeks on Thursday, 6th November. The time is the same, and again, we will have a book presentation. The book Breaking the Silence, Confronting Stigma and Substance Use Disorder will be presented by one of the editors and co-authors, Yifan Yu of Shanghai Mental Health Center. So this is our next meeting. And then we will have in November, we are still looking for a good time. We will have Russian language presentation of this book and also of the women's book written by or edited by Kasia together with others. So yeah, so there are interesting presentations ahead. And yeah, please feel free to join our talks. And if you have questions, you can always reach out. The recording will also be published on our website and on the YouTube channel. So yeah, thanks a lot for being here with us today, and have a great day and see you next time. Bye-bye.
And last